Okay, now I'm going to do the valgus MCL test. So first I'm going to find the head of the fibula, and I'm going to place my thumb underneath it like so. And then I'm going to place my other hand around her medial malleolus like this. And I'm going to push with my top hand and pull with my bottom hand to create this motion like so. And I'm looking for that endpoint. And again, this is for the MCL, so I'm going to perform it at about 15 degrees, and then again at 35, looking for that endpoint. And then for the varus LCL ligament testing, I'm going to do something very similar, just put my body medially. So to test for the MCL, again, I'm going to put my upper hand in like the same spot, and my lower hand around the lateral malleolus this time. And then I'm going to push with my top hand and pull with my bottom hand like so. Again, looking for that endpoint. And I'll do it at 15 degrees and then again at about 35. Now I'm going to perform the Lockman's test, which is for the ACL. So I'm going to make sure my patient's nice and relaxed. And I'm going to take my right hand and put it above the patella, and then take my fingers and wrap it behind the knee. And then I'm going to take my left hand and place it in the tibial flare with my fingers behind on the gastroc heads. And then I want to make sure I have a lot of force, and I'm going to create a shearing up and down motion. So I'm going to push down with my top hand and pull up with my bottom hand like so. And again, don't be afraid to use like a lot of force. Okay, now I'm going to perform the pivot shift test, which is used for ACL tears and to test the stability of the anterior lateral capsule. So I'm going to make sure the patient's nice and relaxed. Then I'm going to bring their leg up between my arm and my thorax, like so. Then I'm going to have my hands below Gertie's tubercle and my thumbs along her tibia, like so. And this test is performed in 4 steps. So first I'm going to internally rotate her tibia, like so. And then I'm going to apply some axial load. And then I'm going to apply a valgus force, so I'm going to push it inward. And then finally I'm going to bring the knee up into flexion. And a positive test would indicate, you would see the tibia jumping forward and shifting. So in order to put the tibia back, we have to perform a Houston's test, which would be bringing the leg back down, allowing that tibia to go back into its proper place. Okay, now I'm going to perform the anterior drawer and the posterior drawer test. So first for the anterior drawer, we're testing the ACL. So I'm going to have the patient's knee flexed like so, and I'm going to have their foot at a neutral position. And I'm going to sit on it to stabilize it, and I'm going to place my fingers behind on the gastroc heads, and I'm going to have my thumbs on the tibial tuberosity, and I'm going to push and feel like that. You'll feel it clicking, like so. I'm going to do this motion. I'm not going to be afraid to use a little bit of force. And then the Slocum's maneuver is used to test if there is a tear in the anterior medial band. So for the Slocum's maneuver, we're just going to take the foot and turn it outward like so, and then we're going to perform the same test. So I'm going to put my fingers behind onto the patient's gastroc heads and my thumbs back on the tibial tuberosity. And again, do that same motion. And then for the posterior drawer, we're testing the PCL. So I want to have her foot inward, like so. And again, I'm going to sit on it, have my fingers in the same spot on the gastroc heads, and my thumbs on the tuberosity, and create the same back and forth motion. Okay, so the next set of tests we're going to perform are testing the PCL. So first we're going to start with the sag test. So I'm going to make sure my patient is nice and loose. And then I'm going to grab at the bottom of their heels like this and just pull their legs up straight, like so. And then I'm going to have another allied healthcare professional stand on the side of them and look if there is a bow in the tibia. And also, if there was a tear, then the patient's feet would be externally rotated with the sag test. So then to move on, we're going to go to the Godfrey's test. And for the Godfrey's test, I'm going to want the patient's knees at about 90 degrees, like so, grasping at their heels, like this. And again, I'm going to want to have an allied professional standing from the side looking for that tibia bow. And then again, this is also testing the PCL. And then from here, we can do the Loomer's test, which I'm just going to take my hands and externally rotate both of her feet like so. And this is checking for the capsular stability of the PCL. And again, I would have that allied healthcare professional check for the bow of the tibia. Next, we're going to perform some special tests. So these special tests are going to be testing for capsular swelling. So first is the palatable patella test. So I'm going to take 2 fingers and just press lightly down on the patella like so. And a positive would be if the patella were to pop back up. And hers is not. So another test that's performed for capsular swelling is the sweep test. So I'm going to apply pressure when I do this test, and I'm going to do it through the tibial flare, like so. So I'm going to start the tibial flare and then go up, again applying pressure. And when I do this, I'm looking for a bulge here laterally, because that would be the fluid that would be coming from the sweeping motion. And then a positive would be if I were to release my hand, the fluid would disappear and go back into here. Again, this is a sweep test. Set of special tests are going to be testing the eye band. So the first one is the Ober's test, which is going to test the tightness of the eye band. So I'm going to have the patient lay on their left side, and they're going to have their bottom knee flexed at about 90 degrees. And then I'm going to take their top leg in between my arm and my thorax, like so, kind of in my armpit. And then I'm going to have my left hand stabilizing the pelvis, like so. I'm going to have my right hand kind of along their tibia here. And I'm going to pull back on their knee a little bit, really stretching the tensor fasciolata muscle. And then I'm going to push down, and I want their knee to touch the table. Again, stabilizing at the hip. And a positive would be if their knee does not touch the table. Okay, so again, that's testing for tightness. And then I'm going to perform the Noble's test. So I'm testing for flipping of the eye band. So I'm going to come laterally onto the patient and feel for the lateral femoral epicondyle. And I'm going to have very light pressure, because I'm going to want to feel that flipping. So I'm going to want to have the patient passively extend their leg, like so. And then towards that last 15 degrees of extension, I'm going to want to feel for the flipping of the eye band, which would indicate a positive test. And again, I want to have light pressure. The next special test is the Wilson's test, which is testing for OCD and/or osteochondral defects. So I'm going to do it on the patient's right leg here, and I'm going to have them internally rotate their foot, and bring their foot in towards them, and then passively extend their leg, like so. And then if there were any points of pain, I would have them stop and externally rotate their foot where their pain is. And if their pain were to go away once they've externally rotated their foot, then this would be a positive Wilson's test. So again, if their pain went away with the external rotation, it would be positive. The next special test is going to be performed for the circumference of the knee joint and the thigh. So first we're going to want to find the knee joint, which is about right here. And this is our starting point. So we're going to put our 0 marker here, and then go up to about 10, and just kind of eyeball where every 2 inches is. So 2, 4, 6, 8, and then 10 up here. So then we're going to measure the circumference. So again, we're going to start at the 0 marker and come around like so. So again, this was at 0, and then like I said before, we're going to go up every 2. So at the 2 inches, and then up another 2, at the 4, and then again, at the 6, and then so on for 8 and 10 as well. And then you're also going to want to do this on the other leg. We're going to want to do it bilaterally, so that we compare. And then that way we can tell if there might be any swelling or muscle loss. So the next special test is going to be for the Q angle. So we're going to measure the Q angle. And first I'm going to find the patient's ASIS, which is right here, and then when I have them put their hand on it like so. And then I'm going to use the bottom of the patella as an axis marker. And then I'm going to stabilize, so I'm going to set my goniometer like this. And I'm going to stabilize the stabilizing lever arm along the infrapatellar tendon like so. So then I'm going to start at 0, and then I'm going to use the ASIS And I'm going to move my goniometer in line with it, like that. And my patient has about 11 degrees, which is normal because females is about around 13 degrees for acute angle. The final test I'm going to perform for special testing is the HELFAT test. So I'm going to have my axis of my goniometer at the superior pole of the patella, and then I'm going to stabilize it here along the femur. And then I'm going to use the patient's tibial tuberosity as a measuring mark. So I'm going to start, and that's my there as my 0. So then I'm going to have the patient extend their leg. Okay. And then I'm going to move the stabilizing lever arm to see how far the tibial tuberosity moved. And this one went about, I'd say, 8 to 9, which is normal because you want about 10 degrees of rotation.